Welcome, everyone, to another episode of the Elevate Health Podcast brought to you by MediGlobo. Again, I'm your host, Jeffrey Rennie, and I have a very great episode with you guys today from someone in our community here in Tampa. The focus of today's episode is on international medicine, international nursing. This individual comes from India and has worked both in India and in the US and has a perspective on both. So I'm so excited to learn and really discuss the differences between our healthcare system versus international healthcare systems, in particular India. So with that being said, thank you, Leo Charth, for going and being part of the program today. Thank you for joining us.
Thank you, Jeffrey.
So, like you told me before, you worked in the VA. You have some specialties in you work in the spinal cord unit, right? Great. Can you give us a little introduction of your background and your history when it comes to nursing?
I passed my nursing in India a long time back.
A long time back. You're a veteran nurse.
kind of. Then I worked in a couple of Indian hospitals, especially in ICU. Then I moved to.
How many years were you in India?
After almost 3 years.
Almost 3 years.
I worked.
Okay. Gotcha.
3 years I worked in India. I have a little bit of teaching experience too. That was like a couple of months. Then I realized I won't be a good teacher.
Well, you're doing a pretty good job now. So.
maybe. But it was the beginning. And then I moved to USA. My first job was in a nursing home. That was only 1 or 2 months. But then I got a job with Baycare. That was I worked as a med-surg nurse in Baycare.
Yeah.
I worked there for 4.5 years. Then I got a better opportunity with Tampa General Hospital. There I worked as a cardiac nurse. It was the best days of my nursing. And that was the best hospital too. So then I got a job I worked in TGH for 5.5 years.
Wow,
and then
that's a long time.
Yeah, in the same unit. Then I moved to VA, and it's just over a year.
Okay. What made you move from TGH to the VA?
It's probably I loved my TGH job, but maybe the benefits or it's a government job. Maybe.
Believe me, my mom's been working there for 20 years, so she always says the VA. She tells everyone, "Oh, you gotta join here for the benefits, the
same.
hours."
I think. It's the same. It's the same. I think little more better salary. I think.
Yeah, for sure. So definitely, that's really great to hear that you have all that experience. What brought you into nursing? What was the driving force that made you pick that career over something like engineering or art or something like that?
My math scores were terrible. I don't want to lie.
Automatically out.
Automatically, this was my only option. Looking at my math scores, I couldn't think of being an engineer. So, but I think what to say, lived in a family or lived with the grandparents.
Yeah.
We always have compassion to older people, or we are always ready to care people. So I think
for sure.
that made my nursing journey a little bit easier, living with my grandparents from my dad's and mom's side, or helping them when they are old or on the last few days makes the nursing
gives you that inspiration to want to
that
get
experience
into that, for sure.
Or my mother took care of both the parents, actually. Both of our parents, my dad's parents and my mom's parents. So automatically helping her will be our routine too.
And you did all your studies in India, right?
Yes, I did. Yeah.
So can you kind of explain to the audience, what are those differences? Because we're used to probably that 4 year. Is it the same 4-year degree in college, or how does that look?
I realized that difference when I wrote the NCLEX RN in India. it's more like an essay based or
Oh, really?
yeah.
So it's not like ABC. You just
No,
write
no,
like
no.
a.
We write a good essay.
Oh, really?
You know, certain formats. I mean,
So they'll give you like a case or something like that, and you just describe how you would deal with it, or how does that?
it's more back in the days they were asking about the health conditions. If it's a med search questions,
Okay.
mostly about the health conditions.
So I'm so curious. When you first started working, did you stay like at home, or did you move out? Like, how was that process? And can you also talk about how that was different when you first came to the U.S.? Because I'm sure it was like similar, right? Like going into a new place. Like, how was that like for you?
Oh, I mean, I have to move after my plus two here it's 12th. I mean,
Yeah.
after my plus two, I have to move to a different state. I mean,
Oh,
which is
wow.
nearby Sidhu's place actually. I mean,
Yeah.
so I stayed there 4 years. I mean, fortunately I was in a college hostel, so I don't have to cook or anything.
Oh, good.
But then we go to different places to find a job. Back in the days, it was so hard to find a job for male nurses.
Yeah.
So I have to go to I don't know, you heard about Maharashtra, Mumbai, right? I mean,
Oh,
Bombay.
yeah.
Yeah, it's Nagpur. I had to go to Nagpur. I had to go to Belgaum, different places to find a job. Once you find a job, it's easy.
And like you were telling me before, like you said that most of the data recording and everything was all pen and paper, right, in India,
Yeah.
versus here
Yes,
you're using
Prabhu.
all these like electronic systems.
Yes.
So going in and having a little bit of a technology acumen, you would say, is like important, especially for people just starting here.
Yes, I really struggled on that area. I mean, that was one thing too. So, uh, I was like cross-checking everything 4 times, 5 times.
Yeah.
I was too stressed about it. Oh, am I doing it right? Am I doing it wrong? I was asking my fellow nurses.
Do you feel like there's any cultural differences between, patients and just like the whole system in like India, for instance, versus the people here?
Yes, that's definitely there. I mean,
Mm-hmm.
The cultural difference in India, the patient feels like, oh, they treat the healthcare professionals like if you I don't know the
Like entitled almost, like they feel like they can tell
Oh,
them
yeah,
anything.
at least for doctors, I mean, they care like they treat the doctors like, oh, he's going to save my life, or with so
it's
much
like
respect.
So much, like they don't even question it. Like
They don't even question it.
go in and like, okay, so not even an entitlement. It's like a almost like worship.
Yes,
High
yeah,
respect.
high respect.
Yes.
But
I
here
get what
they
you're
treat
saying.
us equal, or here the patient rights are much more.
And they almost feel entitled, you would say.
Yeah, they know what they are doing, what they want. They are very sure about it. But that's good in a way, I think. So they know their body well. In India, what the doctors say, what the nurses say, that's it. But here, they know. The patients are very well educated. So
And it's also like resources. So how does it work in terms of like payment? Because obviously here we have like insurances that like take care of, a deductible. Is it the same like process there, or is it more like universal healthcare? Like how does it work?
There we have to pay everything out of pocket. I mean,
Really? Everything's private pay over
but
there.
that's same thing. I mean, so that's why they try to not to pay to nurses. So that's why
Well, yeah,
that's
yeah,
why
that makes
Indian
sense,
healthcare is so
yeah.
affordable.
Yeah.
So when the nurses'
'Cause the
salary
nurses
went
only
up,
yeah.
everybody's salary went up. The health, I think now they are implementing more insurance there, but
Mhm.
definitely nothing close to
Well,
what
yeah,
we have
we're
here.
Yeah, because there's goods and bads and everything, right?
Yeah,
Like you
for
go in and like, it's in some ways. Well, let me understand this. If you, let's say, just don't have any type of health insurance and you're a private pay person in India, you go in and you have some type of emergency, and you're poor. Who pays for that?
That's why we have free hospitals.
Oh,
That
so there's a
the
free clinic.
government hospitals. I mean,
Okay.
we hardly pay for anything. It's like, I mean, definitely there are challenges, but we see big queue in front of that medical colleges or government hospitals all over because I worked in different states, but everywhere it's the same. The
Mhm.
government hospitals, we see a big queue, like it's always so crowded.
Do they have private hospitals like Advent Health and stuff like that, or is it mainly these government
I
hospitals?
think the Indian private medical colleges has to
Mm-hmm.
treat a certain number of patients for free, of course,
Mm-hmm.
because they are charging the students, the medical students, because we are a specimen. I mean, if I'm going for such a medical college, they treat me like a specimen, so the students can learn things
Yeah.
on my body.
You're a test dummy.
That's time, yeah.
So you've been a nurse really for 14 years. Oh wow. So how has technology adapted and changed since you started like going in? Have you seen like it, be used more and more? What are some concerns? Like how has technology and its role in medicine changed since you've been a nurse?
I think basic nursing should be the same, because cleanliness,
Mhm.
like you said, the
human body.
sterile we treat.
Yeah.
But I mean, I'm proud to be an SCA nurse, because I seen the PT, the physical therapy, or the equipments they used. I mean, most people are paraplegic for 30 years, 40 years.
Mm-hmm.
Some of them are like, but still, not in my unit. When we float to a different unit, he leaves with his eye gaze. The only things moves his eye. That's his eyes.
Oh,
So the
wow.
computer in front of him senses his eye movements.
Oh,
And
wow.
He communicates his family calls. Then that with that eye gaze, that thing sounds like, oh, I need this, I need that. Please move this, please move that. He can give a lot of basic commands.
Because he's able to use this technology
Yeah,
to reach out to people. Wow.
And I seen like a lot of paraplegic patients walk with, a lot of support. So they walk like normal.
Like
I mean,
prosthetics
a
almost.
lot of people use the wheelchairs, but the young people with good upper body strength
Yeah.
walk so much better, or they're doing so good actually.
Going into technology, we just discussed there's a new platform that, again, shameless plug to MediGlobal is starting called CaresLink.
Mhm.
What are your thoughts on this platform, and what are some things that you see as a technology for nurses and how it can be beneficial for them?
Updating our knowledge is really important.
Yes.
To stay in any profession, but once we are comfortable, sometimes we ignore that area. We
Yes.
just work, and but if you have a easy access of, if you open an app,
Yeah.
and we can get so much useful information, or something keeps reminding us, hey,
You have the certification
you have the
which CareLink does.
certification.
Yeah, for
There
sure.
is a new class or new video about some interesting titles would help you to more informed, and I think help it, getting more information makes you a better nurse and help you to
Definitely.
perform better, or
And even like the networking, like we talked about, we're building that network of different nurses and different, mentors that you can go in and build your career on, especially, as if you were a new international student, someone connecting with someone like yourself who's been through this process, seen all the challenges with 2 kids, a wife, all these things, you can speak better to that and connect to those people, which is an amazing aspect, I'm sure, with CaresLink. And kind of going into that, as an international nurse, someone going in from a different country, what are some of those unique benefits, or some of those things that CareLink helps to fulfill, helps you to bridge those gaps and the deficiencies?
Getting a first job is always tough.
Tough.
So having a mentor to get the first job would be so much helpful, because I met someone in Lakeland. His wife came from India, so he was applying all the hospitals. On a random conversation, I said the first job is always tough. So
Yeah.
always apply on a nursing home.
Yeah.
So he just applied on the nursing. So they were desperate to get nurses. So she got the job in a week or two. She was trying to get that job for like 3 months, 4 months. So that really helped to get that job. And you know, I'm sure somebody's managing things well than us
Yeah.
on a similar situation.
For sure.
For sure. So if they try to explain, or we see a lot of our colleagues or family members are doing their nurse practitioner, having 4 or 5 kids at the same time. They send them to the soccer, so they're managing the things as well. So if you have and everyone wants to do that. Who don't want to be a nurse practitioner or nurse anesthetist? Who want everybody?
Yeah. 100%.
Not everyone, not the motivation, or somebody thinks, oh, it's not possible only with so much big IQ. But
Yeah.
if somebody gets a roadmap, or somebody explains how he did it, maybe it will be a spotlight. It will be a spotlight to a lot of new aspirants, or someone who struggles in their everyday life. I mean,
CarersLink does all these different aspects.
Yeah,
it's all.
I was very, happy to, and I like to be a part of it.
100%, and it's really awesome that we have now these type of technologies in our possession to build ourselves up and to grow. Part of CarersLink, I think, is kind of the idea of giving back, right? And I always think from this podcast too, when it comes to giving back and thinking of the next person, right? Like, how can we help people? What would you kind of say to those people that are just starting? Maybe they're from India, maybe they're from South America, Africa, wherever. What is your biggest piece of advice to them in terms of how they can best, capitalize on working here in the US and, maximizing their career here?
I think I can tell about, I didn't do nothing much. I want to do my master's, but still I'm just procrastinating things. But but
we'll get there eventually.
Eventually, yeah. But one thing I always notice, someone with a good group of friends, or someone with a very motivated group of friends, making things happen very easily. So somebody do this. When my friend is, oh, how you did it. So if you have you are putting a common platform of very motivated people, so that will help a lot of other people to do that. I mean, I explained it right?
Yeah,
you mean,
I
if somebody from Mexico, they might be having they have to learn English, they have to pass RN, so but somebody from India, they know basic English, they studying things in English, so the entire path is different. Or the entire the ways to reach America and get a job should be entirely different. But if somebody put their experience, or somebody put a write-ups, maybe a detailed write-ups, what they did will give them a guideline to the new aspirants of that country or similar situation.
With that all being said, another big part of it is, when you're talking about the immigrant experience, there's always stigma and all these things that are associated with that. I know we talked about it earlier, but can you just speak on some of the things that you've had to deal with, being Indian, being like from India, going into it? Have you ever had to deal with any type of racism or anything like that?
I think it's, again, initially everything is a struggle, actually. Till we learn the language, till we learn to understand them, it will be there. So don't take it, too negative or anything. Just say in mind, one day I'll be there. Don't worry. Maybe in a week or two. I'm not going to stop this because you said this to me, or say some bad words to me, I'm not going to stop it.
Dude, like
It's okay.
things that my mom has told me that patients will tell them, like
Yeah,
go
but
back to your
it's
country.
okay, baby. In 2 days, I'll be there. Don't worry.
Yeah,
I'll be
100%.
there. I mean,
And one thing that's so interesting is that when you're in a hospital, people always, and we just talked about it, you're talking to people that are at their like most vulnerable point, right?
Yeah.
So not taking those things to heart, because obviously when you're going through all these like lack of control, going through a dying process, you're going to go and say things that you wouldn't normally say in an everyday setting. My mom said if I saw them at like a Starbucks or something, we'd probably be good friends, but we just happen to be in a hospital and they're going through a significant thing. So that's really great advice, talking about not taking things too
Right.
seriously and pushing forward yourself and having confidence in your knowledge. So
Yeah.
that's really great. And kind of to just end things, we always do a segment here on the show. I love it. It's called Fact or Fiction. We go through just because there's so much information out there, a lot of misinformation out
Okay.
there. So I like just going through some common things related to our topic and just telling me, is there fact in this or is this mainly fiction? Is that okay with you?
Yeah. But
Okay, so my first topic is international nurses face discrimination. Is that fact or fiction, in your opinion?
it's a fiction. It's a lot about our low self-confidence or self-esteem. But the same nurses will be the manager after 10 or 15 years. It's the same exact person. So if it's a fact, I mean, how she became a manager or like in a 5 or 10 year time, I mean, so the same skin color, the same looks, the same student who studied in America become, she's not facing it. So it's all about our communication skills and our confidence. So
and even if there's those struggles there, you're saying the most important thing is overcoming that, not letting that stop you from reaching your career goals, whether it's being a nurse practitioner.
Don't take it personal. I mean, I mean, we are not going to reach nowhere. I mean,
100%. So my next question: international nurses lack proper training.
Yes, I mean, not in. They're good nurses by skills, but they have their own strong set of skills. But when come to accountability part, when it comes to the charting accountability, the legal part, I think we need to get focus on those training.
Because you're coming from a different system altogether.
Legal system.
We talked about this whole podcast, like India healthcare system versus American healthcare system. There's so many differences, right? And I would even say for a nurse, you're asked to do a lot more in India. So transitioning there to here, that must be jarring, not being able to have as much control or going through a particular protocol, right?
Yeah, I mean, the protocols in America, everything, most things has a protocols. I mean, a lot of regulations and protocols. It's good in a way, and most of the time it's available in front of the computer in front of us.
Gotcha.
So most company provide so getting that kind of, I mean, a mentor who works in the same hospital could help. Could make that transitioning so much easier. If you get a job in TGH, a friend or someone who can, hey, look at that section in the computer, look at this in the computer, write it down, put a note. So that makes that's
why I love the VA, because there's so many people from our community in particular that you have just like going in and guiding you, and I definitely do appreciate all your insights. We're at the end of the show. Is there any big takeaway that you want to tell, the audience or the people at home, just in particular about our topic of international, nursing, medicine, however you want to put it out there? Is there anything you want them to
come to USA? It's a beautiful place to work. Do put your efforts.
Come to the USA. Come to the VA.
Come to the VA. It's a great place to work. I mean, nothing should stop you.
Nothing should stop you. Leo,
come here.
Thank you so much for being on this podcast and talking to us. I know we talked for quite a while. Guys, if you have any questions, please put them in the comments down below. I'm your host, Jeffrey Rennie, signing out. Peace.